I'm joined now by Dr. Rodrigo Rodriguez-Fernandez, Medical Director of Non-Communicable Diseases and Workplace Wellbeing at International SOS. Welcome. Not a lot of people initially will have a great deal of sympathy for business travelers, especially if they're traveling economy. They have the idea it's a life of luxury, sitting back with champagne and caviar and toast. So where's the stress coming from?
That's a great question, Stephen. So, as we heard, the number of cases we're getting, on a day-to-day basis seem to be associated with travel. Now, something really interesting happens when we travel for work. The lines become a bit blurred between where work stops and where it starts. And so we might be emailing our colleagues on the other side of the world at 10 o'clock at night. And because we don't have that structure, that continuity, then this is where we start to see an increase in sort of mental health and burnout and stress.
So the stress is coming from the fact that formerly they could go on a plane and it was a place of safety, it was a refuge, but now they're continuing to work while on board the plane. So they're not resting when they're traveling, they're working and traveling.
Exactly. And we're seeing that as businesses continue to expand, as we see organizations, start to pop up in different parts of the world, that connectivity due to better technology really blurs those lines. And so, as you say, when the day used to stop, at 5, because they're on travel, they, keep on emailing, having phone calls, conference calls, and that's where the stress starts to lay in.
So the stress goes towards mental illness, is that what you're saying?
Absolutely, and one of the things we're seeing is more cases are cropping up to a point where the World Health Organization, for the first time ever, has identified burnout as a medical condition. Now, something that had never happened before.
Now, can you define burnout?
Yeah, so burnout is a work-related condition, a mental health condition that is classified by having a sense of lower productivity, meaning people aren't as effective on the job. There's some other associated symptoms like high blood pressure can be linked to mental health and stress and burnout.
So if they're exhausted and then they're moving towards burnout, that's not a new condition. That has happened to high-flying businessmen for many years. But are you saying that in the old days they could recover from that burnout, from the exhaustion, by going home and sleeping for a week or so? But you're saying that has a lasting effect.
It has a lasting effect, you're right. And I think importantly, because it's now classified as a disease, then it puts other wheels in motion, such as legislation, duty of care, which means companies are now liable and at risk of looking after these employees. If they develop a mental health condition, burnout in this case, then there's some liability in play.
But that must put a lot more pressure on employers.
Absolutely, and we're seeing that organizations that are performing well on the stock market, that have been able to retain their employees, are doing so because they have great duty of care legislation in place, meaning they look after their business travelers.
All right, well, we'll leave it there. Rodrigo Rodriguez-Fernandez, many thanks indeed for joining us.
Thank you, Stephen.